Earlier this week, Premier Scott Moe announced he plans to scrap the vaccine passport system sometime this month. And one reason he gave was his claim that vaccines don't reduce the transmission of the Omicron variant.
The infection rate that we have, the new cases that we have in this province are roughly about the same in vaccinated and unvaccinated people here in Saskatchewan. And so it is ultimately not stopping transmission by the data that we have.
For analysis, we've reached Virologist Angela Rasmussen at the University of Saskatchewan's Vaccine and Infectious Disease Organization. Angela, first, thank you for joining us.
Thanks for having me.
Now, what is your response to Premier Moe's assertion that vaccines aren't reducing transmission?
Well, unfortunately, Premier Moe is incorrect on this point. While vaccines don't completely prevent transmission altogether, and as he himself knows from personal experience, even people who've been boosted can in fact be infected with SARS coronavirus 2, it actually does reduce transmission significantly, particularly when a person has a booster. So some studies that have been done in the US by the Centers for Disease Control have showed that a booster shot actually increases protection against infection all the way up to about 60 to 70%, depending on the study. So they actually are providing quite a significant protective effect against infection with the virus itself, in addition to protecting against severe disease, which he did correctly note. So at population level, even though we may see some breakthrough infections, we are still seeing far fewer cases of COVID-19 in fully vaccinated people, especially those who have gotten their booster shot compared to unvaccinated people.
So what are your concerns when you hear statements like that from Premier Moe or elsewhere from leaders in our province and in Canada?
Well, the biggest concern I have is that when people hear statements like that, they're going to think that, first of all, they don't really need to get a vaccine, especially if they've had COVID-19 before. We certainly know that the vaccines are providing very good protection against infection or against severe disease. But if people think that they're not going to be protected against getting infected at all, they may not seek a vaccination. The second reason I'm concerned about it is that right now we are still seeing increasing caseloads. We still have the potential to see our hospital system be put under incredible stress and strain. If people are not getting vaccinated, if people are relaxing the precautions that they're taking to avoid being exposed, whether they're vaccinated or not, we're potentially going to have even more cases. So while I agree that we should relax restrictions as soon as we can, that means when we're getting cases down. That doesn't mean when we're in the middle of a steep upward climb in terms of the number of cases that we're having. So when the Premier himself is saying get vaccinated, but it doesn't do anything to reduce transmission, I think that's really going to discourage a lot of people from not only getting vaccinated, but from continuing to take precautions over the coming weeks when we really do need to be taking those precautions still.
So, say he does lift restrictions, how do people personally take care of themselves without any government restrictions or anything bearing down on them?
Yeah, so this is a great question, and this is why I really wish that he wouldn't lift restrictions until this wave has passed. But what I would really strongly encourage people to do is that you don't need a mask mandate to continue wearing a mask in public spaces. You can go out and do those things. You can get vaccinated, you can get your booster, you can continue to wear a face covering. In addition to that, I will say that one thing the Premier has done very well is to make rapid tests available to people. Another thing that people can do to protect their communities is to take a rapid test before you're in a situation where you know you're going to be exposed to a lot of people, especially if those people might be medically vulnerable. By implementing these measures, making these decisions to do this proactively without requiring a government mandate to ask us to do it is a good way, I think, to show concern and care for our community and for other people besides just us.
Angela, thank you so much for your time.
It's my pleasure, Dan. Thanks for having me.
Angela Rasmussen is a virologist and research scientist at VIDO in Saskatoon.